Welcome back to the Ultimate Wellness Group. Today is Accolade Day. I'm going to give credit to where the perspective that my videos, my public speaking should go. So as far back as I can remember, I wanted to be a physician. My mother tells the story that when I was about 4 years old, I was sitting with her watching National Geographic Channel, and a show came on about a heart surgery, and I told my mother that's what I want to do. So from that point forward, that's all I ever wanted to do. That's all I can remember for far back as I can remember. And so, of course, like everybody, you go along your journey, your travels, make your mistakes. But the blessing is that I was able to finish Prairie View A&M University near Houston, and then went to Meharry Medical College in Nashville, Tennessee, and graduated, became a doctor, my lifelong dream. Very happy day for me and the family. And then I came to Houston to do my residency program in the medical center that was considered the best in the world. To think today it still is considered one of the first or second best in the world. So after I finished my residency program and I became a medical director at a clinic called Martin Luther King South Central Houston Community Health Center on Martin Luther King and Reed Road, I was the medical director and the physician there, and I was very, very happy to be able to give my gift and my passion to try to help people. So I became part of a clinic that was, in essence, dying. It wasn't being run very well, and I put all my all into it and kind of revived it and got it to a point where there was a lot more patients coming in, and it started to go in a different direction. Of course, I had some issues with some of the management and wound up starting my own practice in the Third Ward area. And one day I was sitting across from a patient, and she put all 17, 18 of her medications on the examining table. She was sitting on one side, I was on the other. And she fell asleep while I was talking to her, and I got angry and started cursing at her. Of course, not out loud. I was cursing her out in my head, and I found myself coming up out of a nap myself. And so I just was kind of saying to myself, I'm angry at her, and I couldn't even stop myself from doing the same thing. And that day when I went home, I was led to read How to Eat to Live by the Honorable Elijah Muhammad, this book here. And once I started reading it, I really just couldn't put it down. In the first 30 to 35, I think 36 pages, he discusses solving diabetes, being able to cure chronic medical problems. He discussed, changing some of the things that you're doing, but never being sick. So these were impressive things to me because I had never read that before. I'd read plenty of medical books. A lot of the medical books I read in medical school were that thick, thousands of pages. And not once did I read anything about never being sick. All of the things that I had read about diabetes, you're going to be taking medications for the rest of your life, but not in How to Eat to Live. It was a powerful book. It was very difficult for me to put it down over the next few days. I read book 1 and book 2. Book 1 has 119 pages. Book 2 has 191 pages. And in those two small books, I started applying what he was teaching to myself, and then I was implementing that in my patient care. And I was watching people solve medical problems that they had had for years. I was watching high blood pressure disappear within a couple of months. Cholesterol problems gone within a year. Diabetes problems greatly improved. A lot of people getting totally off of medications. More severe problems like multiple sclerosis, hepatitis, HIV, heart problems, congestive heart failure. People that have been sent away from doctors saying they couldn't do anything for me. I'm watching these people have things happen to them And they go back to these doctors, and doctors call them miracles. Well, I don't believe in miracles. I believe that when a person uses the word miracle, it's just outside of their realm of understanding. But nothing is outside the realm of understanding of God. And so that brings me back to this book. If you notice that from God in person, that's pretty different. First, we have to admit. And then I'm hoping that that inspires some thought. Why would somebody write a book and say from God in person? What does that mean? Well, the type of changes, the type of improvements, the type of great cures and problem solving that I was watching happen right in front of my eyes, it gave me a new reality of what God is and what God means and what the knowledge of God represents. This book was life-changing. I have never practiced medicine the same since. And in 2009, one of my favorite cousins was going through her third bout of breast cancer. She asked me to help her put together a holistic program because she didn't want to do chemotherapy and radiation anymore. And so I helped put that program together. And unfortunately, things didn't go well, and she didn't win that battle. And I drove to California to her funeral and then drove back. I did all that driving by myself. I just needed some time to think. I needed some time to process her death. I needed some time to process what was going on in the way that I was practicing medicine. Because once I started applying How to Eat to Live and seeing the things that was happening, it became contrary. My spirit wasn't comfortable in prescribing medications anymore. My spirit wasn't coinciding with sending people to these typical things that I was doing, and I don't believe I was ever typical. I was always trying to get people off of medication. I was always trying to help people go in a direction of solving their problems and not thinking that you have to maintain these diseases for the rest of your life. I was never the average physician in doing the things that average physicians do, but I wasn't satisfied even at the level that I was at. I wanted to be somebody that could help people get on a journey of healing and then get there. Not that I'm the healer. God is the healer. The healing is already in us. But sometimes we need a new conduit of information to help us get on the journey and the path so that we can see the solutions. And I'm here to tell you that 116 pages in one book and 190 pages in the other book is what put me on that path. And I am not only more at peace in the way that I practice medicine now, I'm more successful, more efficient. There's never been more of a feeling of enlightenment and a feeling of having the ability to offer people information that you know is guaranteed to get them success, depending on their dedication and diligence to what you offer them. There's not a better place of fulfillment that you can be. And without How to Eat to Live, I wouldn't be there. Without How to Eat to Live, I wouldn't be expressing the type of things that I'm expressing on this YouTube channel. So, of course, you know, I'm in a wonderful, peaceful place when it comes to the practice of medicine, and I had to do a video giving credit to where that came from. And I'm hoping that this inspires you. Hopefully not to think I'm crazy and run away, but to do some research and look at the book yourself and apply the book to yourself and see what kind of benefits you come to. Because that I'm doing this video because I think it's a pretty maybe inspiring idea that a person who studied for so long and worked so hard and so many years of late night studying and late nights in hospitals and many hours in hospitals, many hours in clinics, weeks at a time, months at a time, and all of that I learned was not as capable as what I read in those books. That should be something that should inspire you to want to do some research into the book and see what kind of results you get. That's why I'm doing this. This is not about me. It's about the information and what I've seen it produce in those who have been dedicated to it. So again, today was about giving accolades to the person who deserves them, and that's God first, and then the Honorable Elijah Muhammad for writing How to Eat to Live. So I hope you have enjoyed today's video. I hope it inspires you to search for information, to read How to Eat to Live, apply it, and then see what conclusion you come to. So thank you for tuning in. Thank you for watching. Thank you for experiencing the Ultimate Wellness Group.